Having postponed their wedding twice due to lockdown, 90-year-old Jeff Holland and his wife Jenny, 86, got married in August. Now they're saying "I will" to getting their COVID jabs. They're receiving them in a week when the NHS vaccinated 250 people a minute against COVID-19, having today covered 78% of all those aged over 80.
If I were to get it, I don't think I could shake it off. So I think the vaccine's a marvellous thing, and I'd advise anyone to have it.
But as Jeff and Jenny make plans for their new life together, what's the plan for future vaccinations? Today, US vaccine maker Moderna, which will supply 17 million doses of its COVID jab to the UK, announced results from lab experiments on the vaccine's likely effectiveness against new strains of the virus. Moderna said its studies showed the UK variant had no significant impact on the effectiveness. And while there was a six-fold reduction in neutralisation of the South Africa variant, antibodies were still above levels expected to be protective. But the company said out of an abundance of caution, it was going to test a new booster jab against the variant to see if it's more effective. Despite cases of the South Africa strain being present in the UK, this evening health officials sounded relaxed about the potency of the vaccines we already have.
And I think importantly, even though the work is ongoing to ensure that we understand exactly how the vaccines work with these different mutations we've identified, it's quite unlikely in clinical terms that vaccines would not have some degree of effectiveness even for new virus mutations that we identify.
If booster jabs against fast-evolving new variants are needed, hopefully it won't be until the current vaccination campaign has reached the majority at risk. And the best way to prevent the virus evolving resistance in certain individuals is to keep on vaccinating.
So driving down transmission at population level will make these individual level events more rare, and that should be enough. But whilst transmission is still high, we probably need to be thinking about how we're going to prevent the next variants from emerging, because we really don't need any more of these.
It's understood other vaccine makers are also working to create new versions of their jabs better matched to emerging strains. It's possible in future COVID jabs, like those against seasonal flu, become an annual appointment for many.